Hello, we are a group of nursing students from the University of California, Irvine. I'm Ricky.
I'm Alice.
I'm Winnie.
And I'm Cecilia.
So today we will be talking about ways in which you can enhance your joint health, specifically caring for arthritis. So for today's presentation, we will first differentiate between rheumatoid or RA and osteoarthritis, which is also known as OA. We will discuss risk factors associated with each one and what symptoms to watch out for. We will mainly focus on nursing care for patients with arthritis, and these include applying heat or cold packs, massages to relieve symptoms, and certain medications that may help lessen the pain in patients with arthritis. So lifestyle modifications will also be touched on for this presentation, and we will also be including resources that will provide more in-depth information on what arthritis is, links to resources on financial assistance, and mental health resources and information. So as mentioned, we will first discuss the basics of arthritis. So the two types of arthritis are osteoarthritis and rheumatoid arthritis, also known as OA and RA. Between these two, OA is the more common form of arthritis and is usually associated with aging and known as wear and tear. On the other hand, RA is an autoimmune disorder that affects the joints, and this causes painful swelling that could lead to bone erosion and joint deformity. So in this picture, you can see that a normal joint is placed next to a joint with osteoarthritis and rheumatoid arthritis. So in OA, you can see that the cartilage is more thin. So this causes the bones to rub together. While for RA, the membrane itself is swollen and inflamed, and this causes the pain, and this leads to bone erosion and joint deformity. Now we will be talking about risk factors first associated with OA, because it's the type that is known as wear and tear and associated with aging and joint injury or overuse of the joints puts a person at risk for developing this condition. Women are also most likely to develop OA, especially after the age of 50. Other comorbidities such as obesity, in which extra weight puts stress on joints, can increase the risk. So family history also plays a role in increasing the likelihood of developing OA. So it should also be noted that people who had hand osteoarthritis can also have knee osteoarthritis. The disease process may also be more prevalent in certain races. Asian populations are less likely to develop the disease, while multi-race Caucasians will have a higher risk for developing OA. So although OA is the more common form that is associated with aging, the risk for developing RA also increases with age, especially around the age of 60s. As with OA, RA is 2 to 3 times more common in women than in men. This is because of certain hormones that decrease after menopause, causing women's joints to be less stable. That makes them more susceptible to injuries and developing arthritis. So genetics also plays a role in the development of rheumatoid arthritis. Some people with a gene known as human leukocyte antigen or HLA make them more likely to develop rheumatoid arthritis. Children whose mothers were smokers or those who were exposed with environmental factors will also have an increased risk for developing RA. In women, risk is increased for those who have not given birth. So for the symptoms of arthritis, some symptoms in RA and OA overlap. So you will experience pain or aching in the joints, swelling, and the stiffness. For OA, there is a more noticeable decrease in the range of motion and flexibility, while RA symptoms include weight loss, fever, fatigue, and other symptoms that are felt on both sides of the body. So if you experience joint stiffness on your right knee, it is more likely that you will also experience the same stiffness on your left knee. So next we'll have Alice to talk about ways in which we could care for people with arthritis.
Okay, so how can we care for people with arthritis? So first of all, we can apply heat and cold devices to help with joint pain. Heated devices such as heating pads, heat lamps, and warm baths make blood vessels bigger, and this means that there's more blood flow there, which would reduce muscle spasms. Cold devices such as cold packs make blood vessels smaller, and this helps decrease pain and swelling if the joint is overused. Before you apply any of these interventions to the skin, make sure to look at the skin first. Are there bruises, lesions, open wounds? Because if so, then you wouldn't want to apply these interventions to those wounds before they are clean and disinfected. So make sure to clean them first, disinfect it, and then apply a wound dressing, and then try the heat and cold applications. But only if the person you're caring for is able to tolerate it. And also for both heat and cold applications, make sure that the temperature is bearable so that it is not too hot that it burns the skin, or it is not too cold that it freezes the skin. Another intervention we can do to help with joint pain is massages. So massages have many benefits. The first thing they do is they lower the body's production of the stress hormone, they decrease blood pressure, and they decrease pain and swelling. And then right here, we have a video of a massage being performed on the joints and hands to help reduce the pain and swelling. So caretakers can also mimic the actions in this video to help the people they are caring for.
Light manipulation, just light circular movement all around the finger and the knuckle. And that'll start getting the blood flow back, and you can do long stretches as well. I would start with light pressure first to just kind of get the circulation, get the liquid buildup moved down. And especially with this, drink water, because you are moving toxins, you are moving the buildup fluid that causes in the knuckles, the swollen knuckles, and getting the circulation back. So basically any situation that you have, massage therapy in one way or another will be able to help you and benefit you to become a better person and feel better about yourself and with yourself.
Okay, and then up next, we will have Winnie talking about the lifestyle modifications.
Okay, so low impact aerobic exercises are example of lifestyle modifications that benefit individuals with osteoarthritis and rheumatoid arthritis. A great example is swimming, which is proven to relieve pain and stiffness. The water provides a resistance that boosts strength and range of motion. Yoga and other stretches are also lifestyle modifications that can help individuals with osteoarthritis and rheumatoid arthritis. Yoga and stretching encourage muscle and bone strength. And improvement in balance, hand grip, flexibility, and strength are also seen. Some mental benefits of yoga are promotion in mindfulness, mood, acceptance, decrease in depression and stress. Some exercises that improve muscle strength and flexibility are weights and resistance bands. They make bones stronger, stabilize the joints, and reduce the risk of osteoporosis. It is very important to start slow and low to prevent injury. For diet, make sure to ask a doctor what a healthy weight is for each individual. Diet is important because it results in less inflammation and less stress on the joint. Mediterranean diet is a great example and consists of fish, nuts and seeds, and fruits and vegetables, olive oil, beans, and whole grains. Mediterranean diet also reduces inflammation in joints and benefits the heart too. So here we can see some diet staples for rheumatoid arthritis: salmon, onion, olive oil, peppers, sardines, and quinoa. And as for pain, we also see some foods that ease arthritis pain, like ginger, garlic, spinach, salmon, broccoli, turmeric, and berries. And now I'll pass on to Cecilia for talking about sleep routine.
So another type of lifestyle modification that people with arthritis can do is have a good sleep routine. So sleep is very important for osteoarthritis and rheumatoid arthritis. In older adults with osteoarthritis, poor sleep is associated with pain and fatigue. For individuals with rheumatoid arthritis, sleep problems lead to increased levels of stress hormone and aggravate flares. A sleep routine can be implemented to improve sleep quality. You can also implement a consistent sleep schedule by waking up and sleeping at around the same time. When lying on the side of the bed, make sure to use one pillow below the knee and one under the head to align the spine. When lying on the back, use 1 to 2 pillows under the knee and one under the head. So certain medications that people with arthritis are going to be on are nonsteroidal anti-inflammatory drugs and acetaminophen. So nonsteroidal anti-inflammatory drugs reduce inflammation and provide mild to moderate pain relief. Most commonly, you would see this type of medication as ibuprofen. Acetaminophen interferes with the brain's ability to interpret the pain signals that are coming from your joints. You won't register the pain as much, and this is typically for more moderate pain. A common example of acetaminophen is Tylenol. So for non-steroidal anti-inflammatory drugs, you may want to take these on an empty stomach because they can cause stomach pain and indigestion. So you should have some food in your system first, wait an hour, and then take the medication. Also make sure to check if the person you are taking care of is on any of the blood thinners like warfarin, because it is contraindicated for these medications. For acetaminophen, you can take it with or without food, but just make sure you do not take too much in one day because it is processed by the liver, so too much of it can cause liver damage. The max amount is 4,000 milligrams per day, but for elders, it is better to stay on a safer dose and do not take a dose that exceeds more than 3,000 milligrams per day. So you should also watch out for patients with liver damage, alcohol abuse, and polypharmacy. For all medications, make sure that the person you are taking care of is not allergic to these medications.
So here are some resources. We have some financial resources and also some mental health resources. And so that concludes our presentation. Thank you guys for listening. And if you have any questions, make sure to reach out. And again, thank you for listening.